It's day 4 of the federal election, and while tariffs and the threat of U.S. annexation are top of mind for Canadians, so is our country's healthcare system. The Canadian Medical Association is hosting an upcoming health summit to discuss the impacts some of the health policies U.S. President Donald Trump is making and its impact it'll have on our medical system. Joining us now is President of the Canadian Medical Association, Dr. Joss Reimer. Good morning, Dr. Reimer.
Good morning. How are you?
I'm well. Thank you so much for joining us. Now tell us about how some of U.S. President Donald Trump's health policy decisions are affecting us here.
Well, there's a lot of things that are affecting us based on what's going on in the U.S. because we know that these types of things don't respect borders. So the first thing I would actually say is that income is the #1 determinant of health. So as our income is being threatened with tariffs and with other issues around our relationship with the U.S. and other countries, that means our health is being threatened as well. And if our income goes down in Canada, we know that Canadians' health will be impacted as well. So even just talking about the economy is interlinked with health, and we need a healthcare system that is strong and ready to mitigate the impacts of this threat to our income now more than ever. But then on top of that, there's been policies where they've been cutting research budgets or changing what's allowed to be presented on the CDC website, which is a website that both Canadians and healthcare providers in Canada use regularly to find reliable health information. So these types of decisions where now the information is either not present or not reliable is impacting our ability to provide care here in Canada as well.
Have you seen some of the medical research change the way we do business here so far?
Well, I've seen researchers lose their funding here in Canada. And so this is impacting the work that we're doing here in Canada because we have such an interlinked relationship with our counterparts in the US, where we share research teams and research funding. And so this is something that we're going to feel throughout the country, but also something we're going to feel for decades because research is something that takes a long time. So cuts that we see today are going to impact the future cures that we might be able to find for cancer, for our long-term diseases. This is going to have impacts on Canadians, and really I want to see Canada step up and put health and healthcare at the forefront of this election because we know our health is going to be impacted and we need our federal government to make sure that health is a priority.
Okay, so tell us about this upcoming health summit and what's happening there.
Well, the Health Summit is sort of our big event that we have with the Canadian Medical Association, where we invite physicians, medical learners, and patients to get together to talk about the health system and what our needs are. And so it's happening during the federal election, and we want to make sure that everyone who's asking for votes hears about how important health is to Canadians. And we're even going to have a panel where we have Minister Asselguera will be there along with Minister Jones from Ontario and Premier Fury from Newfoundland, talking about things like how the U.S. policy is impacting Canada. So this is an opportunity for physicians, for patients, for medical learners to get together to talk about what works, what doesn't work, and then bring that information to our decision makers, and particularly right now, those people who are asking for our votes.
Can we talk a little bit about some of the doctors in the U.S.? Has there been any interest on them relocating here to Canada?
Well, I will say one of the most popular posts I ever put out on social media was me saying to a doctor in the U.S. that we would welcome them here in Canada. That got more likes than I think I've gotten on anything else I've ever posted. So there's certainly a lot of interest out there. We're hearing from doctors who are feeling frustrated and wanting to find a space where they're more open to practice medicine without government interference. And so we are open to accepting U.S. doctors. We want to make sure that Canada is a place where doctors can thrive and where Canadians can have access to those doctors. So if there's U.S. doctors who want to come into Canada, we really want to chat and make sure that we're finding a space for them.
Yeah, that would be good for us too. Let's talk about the surge in measles cases in the U.S. We know in Ontario there are 440 cases. Why is this so concerning?
Well, we had eliminated measles from Canada in 1998. So we had 25 years where we didn't really have measles in Canada other than the occasional one that came in through travel. That was a huge accomplishment that we've now undone. And measles is not a benign disease. It's not a minor issue. At best, it's very unpleasant to go through, and at worst, people get severely ill with long-term health consequences, and some people will die. And so this is something that is serious because not only because of the health impacts, but also because it's completely preventable. If we have enough vaccination and our whole community is covered, measles can't spread, but that's not the case right now. And especially the impact that COVID had on the trust in vaccines because of all of the anti-vax rhetoric that we saw online and all of the misinformation, we've we've seen our vaccine rates go down, and just the fact that we got interrupted in our school-based vaccine programs. There's kids who just never got caught back up. So this is preventable. The vaccine is 97% effective, very, very effective. But if you're not protected and you are exposed to the virus, there's a 90% chance that you'll get it. That's how infectious it is. And 90% of susceptible people who are exposed will get infected. So we really want to get the message out there that this is preventable. We have a very good vaccine, and if everyone is vaccinated, then we're not going to be able to spread this in Canada, just like we had achieved in the 90s.
Dr. Reimer, thank you for your time today.
Well, thank you so much for having me.
Anytime.